Today we are joined by Rich Skradski, Teledyne ISCO's Northeast Regional Manager of our water platform group. And we are excited to be joined by Jason Vogel, the Director of the Oklahoma Water Survey and a Professor of Civil Engineering and Environmental Science at the University of Oklahoma. With that, I would like to turn it over to Rich.
All right, welcome everybody, and thank you for joining us today for our webinar on wastewater disease surveillance. Today, we'll be talking about the history of wastewater disease surveillance, the present state of wastewater disease surveillance, and what the future holds. As Sharon said in her introduction, my name is Rich Skradski, and I'm the Northeast Regional Manager for Teledyne ISCO. Today, we are fortunate to be joined by an expert in the field, Dr. Jason Vogel, who will be sharing his experiences, findings, and thoughts on wastewater disease surveillance based on his work in and around the state of Oklahoma with the University of Oklahoma's sewage surveillance team. Before getting to the meat of the presentation, I'd like to take a minute to introduce you to Teledyne ISCO. Teledyne ISCO was established in 1958 in Lincoln, Nebraska, where it has remained until this day. Our environmental division was created in 1969, specializing in the manufacture of rugged instruments used by environmental professionals in the water, stormwater, and wastewater markets. We have been protecting water quality all over the planet for the last 50 years, having invented the world's first automatic wastewater sampler in 1971. Today, I will be providing a brief description of what exactly is wastewater disease surveillance, as well as a brief history. I will then be sharing the various sampling methods used for wastewater disease surveillance, as well as the current best sampling practices and the proper equipment selection for a number of different sampling locations. Dr. Vogel will then share his experience with wastewater disease surveillance as a member of the University of Oklahoma sewage surveillance team. He will be explaining the sewage surveillance process, the benefits, the results of his team's work, and how the results can be used to safeguard public health and to drive public health decisions. Wastewater disease surveillance, previously known as wastewater-based epidemiology, and now being referred to as wastewater-based surveillance, is the broad field of testing wastewater for infectious diseases, pharmaceuticals, and illicit drugs. The change in terminology has been driven by the expansion from pathogens to all forms of public health data and information. The predominant purpose is to detect pathogens for use in public policy decision-making and has proven to be a valuable population-level approach for monitoring viral pathogens. It has also been used for the detection and prevalence of substances such as pharmaceuticals and illicit drugs, providing an early warning and identification of potential hotspots. Two interesting examples of the data that can be collected are from sporting events. The first was at a college football game in the United States where very high levels of opioids were detected, and at a soccer game in England where extremely high levels of cocaine were found in the wastewater from the stadium. At a basic level, it can serve as an independent indicator of disease prevalence. Wastewater-based surveillance was initially proposed as a method for tracking disease as far back as the 1940s. Practical application began in the early 2000s and was successfully used in Israel for tracking an outbreak of polio in 2013. In 2020, the COVID-19 pandemic catapulted wastewater-based surveillance into mainstream attention and was effectively used to determine COVID-19 hotspots and to drive public health decisions. One particular example comes from the University of Arizona, where building level sampling at the dormitory level helped to identify the presence of COVID. When COVID was detected in the wastewater sample, all of the residents of the dorm were tested and the infected students were isolated. There are a number of sampling methods used for wastewater-based surveillance. Each has its place and use. The first is manual sample collection with a dipper. Basically, a container is dropped into the flow stream and a grab sample is collected. While this is a very simple, basic method, it can lead to wide variations in sample consistency and is not very representative of the actual waste stream. It can be used as a quick method for sampling if an automatic sampler is not available, and it can provide a quick indication of the presence of a particular constituent and if additional more representative sampling is required. The second is with a passive sampling device. Basically, an absorbent substance is housed in a container of some sort and dropped into the flow stream. After some period of time, the container is removed and the wastewater is extracted for analysis. As with the dipper, it is a simple, inexpensive method for sampling. But again, it is not representative of the waste stream and can lead to a wide variability in the results. This can, however, be an effective method for detecting the presence of a particular constituent or for identifying a particular strain of a virus. It is not suitable for trending or quantifying the number of infected individuals. The third and industry-preferred method of sample collection is with an automatic sampler. While it is more expensive than the other two methods, it eliminates human error while providing the most representative sample of the three methods. With a variety of programming options, it can be tailored to a particular site, and the sample collected allows for the most accurate trending and quantification of results. For automatic sampling, there are two types of samples that can be collected. The first is a composite sample. Composite samples are collected in a single bottle and represent a composite of the waste stream over the course of a day. The sampler is programmed to collect a fixed sample volume at user-defined time intervals. Every 15 minutes is a typical time frame. Composite sampling is the most commonly used wastewater-based surveillance sampling method. The second is sequential sampling that utilizes multiple bottles. As with composite sampling, the samples are collected at user-defined time intervals, but instead of the samples being collected in a single bottle, the bottle is switched at user-defined intervals. This allows for testing of samples from specific time intervals during the sample collection period. There are a number of ways to collect a composite sample, all very easily programmed into the sampler controller. The first and most commonly used is the time-based fixed sample volume method. With this method, a fixed sample volume is collected at a user-defined time interval. Typically, every 15 minutes over a 24-hour period of time is the interval selected. The second automatic sampling method is a flow-paced fixed volume method. With this method, a fixed sample volume is collected whenever a user-defined volume of flow is measured. This provides a weighted sample based on flow. The more flow, the more samples are collected. This method provides a more representative sample than the fixed time method, collecting more frequent samples when the flow is at its highest. The third and final method is the best method for collecting the most representative sample for wastewater-based surveillance analysis. With the time-paced, volume-dependent method, a sample is collected at a user-defined time interval, but the volume of the sample is weighted based on the volume of flow during that time period. This is the most effective method for measuring constituent loading and will provide the most accurate data for trending and quantification of the results. There are a number of sampler models that can be used for wastewater-based surveillance sampling, all with the capability to do composite or sequential sampling, as well as any of the three previously discussed sampling methods. The first is a permanent refrigerated sampler. This is best used at the treatment plant level, where the sampler will not be moved to different sites due to its size and weight. It is AC powered and it is refrigerated so that ice or gel packs are not required for cooling. The second is a portable battery-powered sampler that is ideally suited for sampling at multiple locations. It can be easily lowered into a manhole for collection system and building level sampling. One drawback is that it's not refrigerated, so ice or gel packs are needed to keep the samples cool. The third is a portable refrigerated sampler. It provides refrigeration as well as portability and is ideal for building level and treatment plant sampling. Now that we've covered sampling methods, sample collection methods, and the different types of samplers, let's discuss the best sampling protocol and sampler selection for a number of different sampling locations. The first sampling location is at the building level, such as dorms, hospitals, prisons, nursing homes, and industries. The purpose is to detect virus presence, to protect vulnerable populations, and to contain the spread. A number of industries that were particularly hard hit during the pandemic are employing building level sampling to maintain production and operation. For sampling at the building level, composite or sequential sampling can be used, and the sampling method can be time-paced or time-paced volume dependent. Typically, portable or portable refrigerated samplers are used for building level sampling due to their portability. And the sampling frequency is generally twice a week for viral concentration. The second sampling location is in the wastewater collection system itself. This allows for the measurement of community spread and for the identification or prevalence of the virus in a specific part of the collection system. This information can then drive public health decisions and actions for the most vulnerable people within a community. The most effective sampling method is composite sampling with an automatic sampler program for time-paced, volume-dependent sample collection. Because the samplers are often located in a manhole, portable samplers are the best and the most preferred sampler for this location. The third and final location that I will be discussing is at the treatment plant or in a catchment area. The samplers are located at the treatment plant influent or at pump stations that have AC power available to test for catchment or citywide community spread and to determine if the number of infected individuals is increasing or decreasing, spreading or abating. Since AC power is generally available at these sites, permanent refrigerated samplers are typically used, either programmed for composite or sequential time-paced sampling. They are generally programmed to collect a fixed volume of sample every 15 minutes over a 24-hour period. Now, I'd like to wrap up my portion of the presentation with some safety guidelines as found on the CDC's and OSHA's websites. Normal practice involves the use of gloves, masks, and boots. And if entering a manhole, confined space procedure should be followed with a ventilator, air quality monitor, winch, harness, and appropriate personal protective equipment. With that, I will now turn over the virtual podium to Dr. Jason Vogel.
All right, thank you very much, Rich. I appreciate that great background, and I appreciate Teledyne ISCO for this opportunity to share what we've been doing in Oklahoma over the last couple of years. I'd like to start with noting our great partners that we have and funding agencies here in Oklahoma, which include the City of Oklahoma City, the Oklahoma City County Health Department, the City of Tulsa, the Tulsa Health Department, the Oklahoma State Department of Health, and the Rockefeller Foundation, in addition to some internal funds that we got from the University of Oklahoma at the beginning of our studies. And we have a partnership between OU Health and the University of Oklahoma to complete this work and this research and this great service that we've been able to do since the beginning of the COVID-19 pandemic in Oklahoma. So let me introduce our team a little bit. The great thing about wastewater-based epidemiology, wastewater-based surveillance is the opportunity to solve problems that are really multidisciplinary, and no one discipline is going to be able to solve everything. Here's our great team, Dr. Katrine Kuhn, who's an assistant professor at the OU Health Science Center in the Hudson School of Public Health, myself, an engineer, Hallie Reeves, who's clinical faculty and in health administration and public policy, Dr. Stevenson, who's affiliate faculty in microbiology at OU and is now also a faculty member at Northwestern in microbiology, but still works with us a lot from afar. Dr. Cara De Leon, who's an assistant professor in microbiology and heads our microbiology laboratory here at OU. Dr. Ralph Tanner, who's an emeritus professor in microbiology. Dr. Keith Stravett, who is also in civil engineering, works with us a lot on sampling and our statewide network. And finally, Dr. Graham Wiley, who's the managing manager of the sequencing core facility at the Oklahoma Medical Research Foundation. And it really takes this entire group and lots of staff and students to do this type of work, because it is so multifaceted, so fast-paced, and lots of things happening within the community as well. And this is one of the most collaborative areas that I've ever worked in my career. Folks across the nation and the world really helping each other out for the good of society. And so we've been working with multiple municipalities across the state and partnering with health departments for impact. And Rich talked a little bit about the different scales that we can monitor at. So I want to just start a little bit on the basics of sewage surveillance. Rich did a great job of setting the stage here. But when we're speaking specifically about SARS-CoV-2, this is all about the release of the viral material, the genomic material of the virus in different ways. And specifically, we're looking at the stool release, which is 10 to the 4 to 10 to the 8th viruses per gram of feces, is also released in these other ways that are shown here on the screen. But once it's in the body, that viral material is released, and that's why we're able to surveil it with wastewater, because it's released in the feces when everybody goes to the bathroom. One question that I always get, and I like to put this out there, can you catch COVID-19 from wastewater? I have never seen a documented case of catching COVID-19 from wastewater, or seen anybody been able to culture SARS-CoV-2 from wastewater. There are lots of other things in wastewater that are infectious, and you still have to take all the necessary precautions when you're handling and around wastewater. But we are looking for the genomic material, not the viable virus in the wastewater. There are numerous things in the environment, including high temperature, high and low pH, and sunlight, that can all deactivate the SARS-CoV-2 virus. So what are some of the benefits of sewage surveillance? One is timely. So we can collect a sample. We collect that sample, as Rich mentioned, generally over a 24-hour period, bring it into the lab, and depending on the analytical method, we can have those results in a day or a day and a half or 2 days, and have it back out to the public health officials so that they have a snapshot in time of what's happening in the population. Within that geographically and functionally representative space. So within that drainage area of the sewer, we're able to sample that. And as long as we're sampling it in a representative way, as we discussed, we're able to get results that are representative on a population level of that area. Next, it's also unbiased by individual testing. Everybody goes to the bathroom, and so once again, if we're getting a representative sample, we're representing that population in that area, and it's not required that somebody goes in and gets tested, and then those results get communicated to the appropriate people so that they can be shared and acted on. And so by cutting out that middleman, we're able to speed up the process. Finally, and this is a little bit of caveat on this, but it cannot be isolated to an individual unless you're very specifically sampling at a location where there's only a few people. But in general, the way that we're sampling these, they're not isolated to an individual. So we're not identifying people that have specific health issues. This is on a population basis that can be utilized for public health decision making. So the general overview is we start off that somebody catches COVID-19 or another infectious disease, they metabolize and excrete the genomic material. It goes into the sewage system, and then from there, we're able to sample it, and we can sample it at different levels, whether it be at a facility level, as mentioned, or at the neighborhood or entire community or wastewater treatment plant drainage. From there, it goes into the laboratory. It's analyzed. We use RT-qPCR. There's other methods out there that other folks use, but drop digital PCR. And from there, when we go, we take it and correlate it to case counts within those drainage areas. And there's a lot of great work looking at correlations and predictions of the actual cases based upon that wastewater. There, from there, you can go into sequencing. You can look at different types of things with the sequence, subvariants, cryptic lineages, other types of things, so you can get even more information. This takes a little bit longer in general than the 1.5 to 2 day turnaround that we get for the other parts of it. From there, the sample is archived. This is a really, especially with SARS-CoV-2, because the science has advanced so quickly, this is really important, because in 6 months, there could be a whole new thing coming out that we can go back and look at and gain more valuable information. And then from there, communicating it to the public health officials and getting the public health response. So as I mentioned, this entire thing is happening within 1.5 days or 2 days. And so that way we can get a jump start on cases that will be showing up and reported a week or more down the road. We'll talk about that in a little bit. So the next thing that's already been mentioned a little bit is monitoring is scalable. So you may be doing wastewater treatment plant facilities. This map shows some facilities in central Oklahoma that we've monitored over the last couple of years. That's looking at community level. You may also be doing neighborhoods. So that's a substewardship and generally monitored from manholes. All of these neighborhoods in this map are within that larger blue area in Oklahoma City, and there's 13 neighborhoods that we monitored in that location. Or you may be looking at the facility scale. We started off our wastewater-based epidemiology journey by monitoring the dormitories on the OU campus over the 2020-21 school year. So the sewage surveillance process, it starts here with sample collection, and as mentioned here, this is really a quest for representative samples, and we utilize the avalanche and now the blizzard auto samplers a lot when we're out in the field for this purpose, to make sure that we're getting the best sample that we can, because if we don't get a good sample, none of the results are going to mean anything down the road. So there's, as mentioned, there's different types of samples that we can get. First off, the grab samples, especially when you're just starting at an area, wanting to see what's there, getting an idea of what's showing up. The time-weighted composites, as mentioned, are the next best one, and sometimes there's locations where it's just really difficult to measure flow, and that may be the best sample that you can get. But if you can get a flow-weighted composite, that can help you out a lot more to know that you're getting something as representative. Over in residential areas or in a dormitory, there's not a lot of flow in the sewer overnight because there's not as many people that are active and awake. As an example, and this right here actually shows, we took some side-by-side samples from a dormitory on campus, and the sample, these are triplicate samples of the same location. The ones on the left side of your screen are time-weighted composites. The ones on the right side of your screen are flow-weighted composites. So in addition to being representative, at night when we were sampling, we sampled once an hour when there was not a lot of flow, and the auto sampler actually sucked up more of that biofilm scum from the bottom of the sewer, made the samples have more solids, and they actually had more inhibitors in there, and so they were harder to analyze, whereas that flow-weighted composite was collecting more often when there was more flow going by, more representative of the population, but was also easier for us to analyze in the laboratory. So there's multiple reasons for us to be trying to emphasize flow-weighted composites if we can. And then the final sample type that is to some extent more experimental from a quantitative basis is sampling with passive samplers. We're utilizing this 3D printed design from a colleague down at Monash University in Australia, and sampling with tampons, so the cotton buds inside of there. And we have some research going on looking at trying to quantify what's in the tampons and comparing it to our flow-weighted composites that we're collecting simultaneously. And that's still coming along, and we're looking at 10 different types of pathogens as part of that process. So some viral things may behave different than bacterial, but stay tuned to see how that goes. So after you collect the samples, then you're going to bring it into the lab. And for us, we're using our TQ-PCR, where we prepare the sample, concentrate the virus with polyethylene glycol or PEG, extract and purify that genetic material, and then do the analysis to quantify a viral count. So here's just some examples of some of our results that we've seen over time. So first off, at the largest scale with our communities. So here's the Oklahoma City Metro, where we're sampling 5 different wastewater treatment plants that represent most of the population of over 500,000 in Oklahoma City. And so here's just an example of our results. You can see that we rise and fall based upon the different trends that are going on. This is results mostly from last year, not necessarily up to date, but we're able to really see the trends and see which part of the community is higher at a specific time. So then within neighborhoods, we monitored 13 different neighborhoods within Oklahoma City, really worked closely with Oklahoma City County Health Department, and they've been a great partner for us all the way along, and utilized this neighborhood information to guide initially testing pods and later vaccine distribution, also monitoring trends, predicting outbreaks, and later to monitor vaccine efficacy and genetic variants in those locations. Although the vaccine efficacy stuff is probably relatively limited in what we've been able to do with this specifically. So here's another example of those results, and we have a dashboard online that our partners can go out and look at this and look at specific neighborhoods or wherever they're interested in, just kind of based upon which drainage drainage line it's on, and that's where the names come from. So we also looked at neighborhoods in Tulsa, and this was part of the work that we did through the Rockefeller Foundation, partnered with the city of Tulsa and Tulsa Health Department at some neighborhoods that are within a larger wastewater treatment area that is called Tulsa North. And so here you can see on this map, the fairgrounds is actually nested within the broader Coal Creek area. And so those were some neighborhoods that we called dynamic sites, because we would monitor someplace for a while and then look at another objective as part of our Rockefeller Foundation funding. And so here's some of the things we did. We wanted to compare neighborhood risk level to concentrations, investigating utility of nested sites, investigating the utility of using event centers to monitor for potential super spreader events. And then we also looked at the Tulsa Airport as a sentinel site for new variants potentially moving in as part of that. So the first one, when we looked at Tulsa, they, based upon testing data and information, they would classify different zip codes with as risk zones, from minimal, which was green, to moderate, yellow, and high or severe risk, orange to red, based upon percent of population that tested positive, knowing that some areas there's not a lot of testing and reporting going on, and so they weren't sure how that was working out. So we wanted to utilize the population in these 3 areas and our wastewater to see what's going on. So first we looked at the Flat Rock Basin, which was in the green, as shown here. 32,000 people, 1/3 of those below the poverty line and 69% minority. Coal Creek Basin was in the yellow. 1/8 of them over 65 years old. Once again, 30% below poverty level and 43% minority. And then finally, the Stone Creek Basin, which was not shown on that other map, but also is within the Tulsa North area, that is 31% minority, only 12% below poverty level. So this is more of a suburban neighborhood, but it was shown in the red at that time. And so we went and looked, sampling these locations, and you'll see there the neighborhood, the broader neighborhood, that part of town, Tulsa North, is in the blue. Flat Rock, which was showing green, actually matched the neighborhood sampling pretty well. But it also had the highest poverty rate, probably the lowest testing rate, but did show the highest concentration in wastewater, whereas Coal Creek during part of this time was actually our lowest concentrations in wastewater, and Stone Creek Farms, which we weren't able to sample for the entire time, was also relatively lower. And so because wastewater is unbiased in its measurement, it seemed that this was doing a somewhat better job of characterizing those areas than the risk zones that they were developing based upon available testing data. So we also looked at the Tulsa Airport as a sentinel for Omicron, and you'll see right here in this map, that upper blue line is our broader neighborhood concentration. That darker blue line below that is the concentration at the Tulsa Airport, which was generally lower. It's a smaller facility, but we're able to sample the entire area. And so we were trying to see, is there a higher proportion of Omicron compared to Delta? This was over last Christmas break when Omicron was coming into Oklahoma. And when we first started, we actually did see quite a bit higher percentage of Omicron. It seemed to serve as a sentinel site for us. We were not, on that first sample, it's only one data point. By the time we were able to continue, Omicron was starting to come, it came in pretty quickly, and we were able to see there that after a little while, the airport was the same as the surrounding community, but it did appear to be a sentinel site at the beginning, and we hope to, hope is maybe not the right word, but if we have another potential wave coming of another variant coming into Oklahoma, we would like to be able to utilize the airport as a potential sentinel site for that. So let's talk about facilities a little bit. As I mentioned, we monitored the dorms starting at the beginning of the fall school year in 2020, going throughout the semester, had a break over Christmas, and then continued again on the spring semester. And you can see there that there's some times after Thanksgiving where there was a peak on campus. Shouldn't be too much of a surprise, and then it went back down a little bit. Before school started, it was relatively low, and then by January 25th, as school had been in for a week or two, peaked up quite a bit, continued to go down till March 18th, till right before spring break, and right before Easter, and then after everybody got back from spring break, and then back from Easter by the end of March, it peaked out again, and then finally it continued to fall off until the summer of 2021, which it got pretty low. That was before the Delta wave started to come in. So it was really useful for our administrators to kind of see the unbiased trend that's happening on campus, and be able to make decisions accordingly. So I had one of my master students, Emily Rhodes, do a project looking at the impact of the OU football games on wastewater concentrations. And this is one example of one of the games. This was the University of Oklahoma, Oklahoma State football game in 2020, sometimes known as Bedlam. And we took samples hourly at the wastewater treatment plant. And you can see there that before the game, as tailgate was going on, it continued to increase until the game started. Everybody went into the game, and it started to drop off right after the game started. And as the went through the game and then into the evening, it continued to drop off until about midnight. That's a very social evening night in Norman for football after the football game, and so there seemed to be a little bit of a spike later on in the evening as the bars closed. So we're also looking at events, and this right here is pretty busy, but we were looking at the neighborhood, which is really the Tulsa Fairgrounds Event Center that has lots of events. That's the gray line. The blue line, once again, is Tulsa North, which is the area around that. And the first event we looked at, which is the Chili Bowl, it's a car racing, and our first event, which was in January, right at the beginning, right at the peak of the Omicron wave, the concentration at the event center was quite a bit higher than the neighborhood around it, and we were thinking, oh my, this might be really indicative of something where there's more going on at this location than there is in the surrounding community. So we continued to monitor that location throughout the spring with many different many other events going on that brought folks from the region and beyond into that location. I think a good thing for us, we in general saw the same concentration or a lower concentration at the event than we did in the surrounding community. So in these locations, it did not appear to be serving as a super spreader event. All these samples, once again, were collected with the auto sampler and were 24-hour composite samples during the day of these various events that were happening at the Tulsa Fairgrounds. And so from there, we were able to do a one-time statewide surveillance back in the fall of October, from October 4th to 12th, 2021, looking at SARS-CoV-2 concentrations across the state of Oklahoma, trying to see where some of the hot spots are. Here we just broke them into quartiles on this map, and so the larger red dots are the upper quartile at this time. So in addition to that, we've had the great opportunity starting this past summer to work with the Oklahoma State Department of Health to expand our infectious disease monitoring across the state of Oklahoma, adding 30 communities. We have a public dashboard out there for SARS-CoV-2 and wastewater, and internal data at this point for 9 different infectious disease pathogens. So you can kind of see here what our trends are, what our dashboard looks like, and some of the ranges. I'll describe a little bit more what those ranges are here in a second. So how do we make use of all this data? Well, what can wastewater tell us about infectious diseases? And I want to give credit to Dr. Katrin Kuhn for this slide, our epidemiologist on the team. But this is the general pyramid of how the results from infectious diseases would generally happen and be reported. First, there's exposure. Somebody becomes ill, they seek care, they obtain a specimen, it has to go to the lab to test for that, it's confirmed, and finally it's reported to the health department or the CDC. And so that's when we find out about the disease, doing traditional surveillance through our health system. But with wastewater, we're actually looking at the bottom part of this pyramid. We have exposure and somebody becomes ill, they go to the bathroom and we collect that sample. And so we're able to find out sooner what's going on by utilizing wastewater surveillance. So how is this used from an epidemiological standpoint? We can use it to understand community transmission of infectious diseases first by identifying the time between the peaks in the wastewater and the peaks in the reported cases. So this is a time lag of a certain period of time that's identified through statistical correlation analysis. And then we quantify that relationship between the wastewater and the reported cases by utilizing a model that incorporates that time lag. And then we use that model to predict cases, quote unquote, in the future based upon that model and what we see in the wastewater with that time lag. So here's an example of this is our data in Oklahoma City. You'll see at the beginning, we had a really good match between cases and wastewater concentrations. This was utilizing all of our neighborhood concentrations and combining them into one model. But then around January 2021, testing dropped off. There was more emphasis on vaccinations. There wasn't as much reported community infection, but you can see that our predictions from the wastewater were quite a bit more than the cases that were out there. That shouldn't be a surprise to anyone. And then when we got into the Delta area, we actually came back and matched predictions pretty well. Cases went down and we predicted higher, and then Omicron came in. That changed everything. There was a different relationship. We actually went down to a 5-day predictive period, but we're able to get a new model and then match that up pretty well. And then afterwards, testing once again went down. According to wastewater, we're seeing a higher level than reported of community transmission. Probably not a surprise, especially with at-home testing and those types of things. And so another thing that's really interesting, and Dr. Kuhn is the lead author on this paper that we brought out on this, is that we were actually able to see different lead times based upon demographics in the individual neighborhoods, both from age and ethnicity standpoint. So we're communicating this, and this is what our initial draft of a one-pager utilizing the CDC levels, basically taking our model of between cases and concentration and putting it in a uniform way across all of our neighborhoods and finding out what predictive level of cases that is, and so then we can determine which concentration correlated to low, moderate, substantial, and high of the initial CDC levels. Those have changed since then, changed a couple times, and this is where we're currently at right now. Is there's 3 levels: low, medium, and high, with breakpoints of 800,000 and 2.7 million between the low, medium, and high concentrations, and then we can use that as a data point and a guidance for communicating with public health officials and the public. And you'll find this on our COVID-19 dashboard. So we're also expanding out to other pathogens. One of the first teams in the world to do this on a consistent basis, and we had confirmed seasonal variation of Salmonella, Campylobacter, Shiga toxin producing E. coli, and norovirus between July 2021 and June 2022. We continue to do this now across our statewide network. We have assisted with outbreak detections and investigations at facilities, including long-term care facilities where they may have a gastrointestinal outbreak, but not a lot of people are getting tested. They don't necessarily know what it is. And so we utilize wastewater sampling. A lot of times those may be with the passive samplers, so we can see what's the predominant pathogen that's showing up in those areas. And so we've been able to confirm, especially on norovirus, several outbreaks that didn't necessarily get tested for. Here's an example of the first one that we did for this, right when we were beginning to sample wastewater. Dr. Kuhn saw a news article that said small community in Oklahoma, Tuttle, which is southeast of Oklahoma City. They closed on a Thursday and Friday because of a stomach virus outbreak, and she gave me a call and said, "Hey, do you know anybody in Tuttle? Could we go out and get a sample?" And we quickly got on the horn got out there and were able to sample. And you can see this blue line here. We didn't necessarily know what everything meant, but you can see some of the other communities, what their concentrations are. And you can see that our concentration in Tuttle was 4 times higher than anything we had seen in any of our other sites that we were sampling to that point. And so we were able to identify and share with the health community that, yes, we are seeing a lot of norovirus in Tuttle at that time. So now we're moving towards a 32 community network, including Oklahoma City and Tulsa. Still working towards that. We started this summer, but this will allow us to continuously monitor SARS-CoV-2 and other public health or other infectious diseases over time, and move towards targeted public health action. Also, seasonal surveillance, as I mentioned, of these foodborne pathogens, vector-borne diseases. And the goal is to develop an algorithm that will identify outbreaks through threshold alerts. The clinical reported data is even more sparse for a lot of these other diseases than it is for COVID-19, but we believe that we should be able to get to a point where we're able to create outbreak thresholds. So to summarize, our key messages are wastewater surveillance is relatively cheap, it's simple, and it's population representative, and it's a great way for us to monitor infectious diseases and also other types of potential things like illicit drugs. So it's gained unprecedented traction since the COVID-19 pandemic. It was occurring at a much less rate before that, but the COVID-19 pandemic really sped that up for testing, independent assessment of trends, hotspots, public health action impact. And as I mentioned, the nationwide and worldwide community of researchers in this area are really open, really great to work with. And so it's really been a pleasure for me as a scientist to be a small part of that. There's still many opportunities to expand targets to other pathogens that are underreported with traditional surveillance methods. And finally, a regional or statewide surveillance network can aid with outbreak investigation, prevention, and control, and especially with particular emphasis on underserved communities, because many of the communities may not have the reporting or testing capabilities on a clinical standpoint, but for relatively lower cost, we can monitor them on a population based way and get the resources out there if it's needed based upon what we're seeing. So with that, for any of you online that have been to Oklahoma over the last 2 years, we thank you for your contributions to our research, and I would be happy to answer any questions you may have.
All right, thank you, Dr. Vogel. Very good stuff, very interesting. Thank you for your time and taking the time to present with us today. I'm going to give everybody a chance to, if they have any questions, to go ahead and input those questions. Please use the Q&A function. As Dr. Vogel said, if you have any further questions about his study and the work they're doing, his contact information is at the bottom of the screen there. Was one question, Dr. Vogel, that I saw, which I do believe you answered, but question was, this is a very impressive study. Are you looking at expanding to other infectious diseases, which I believe you did answer, and I guess a follow-up to that question that I would have is, you know, where do you see this going? You do kind of address that, but it seems like the potential is limitless.
Yeah, I would agree with that. There's a great potential for contributing to public health decision making. You know, this isn't the end all be all, but it can definitely be an important data stream to kind of identify what may be going on because of lack of clinical results. And sometimes, you know, you may not know in a small town that has an outbreak where the source is. And so this can help you triangulate and figure out where things might be coming from and help with public health action.
Okay, great. Another question. What recommendations can you provide as far as selecting sampling locations for collection system monitoring? What do you find the best way, or what do you think the best way is to establish a surveillance network in a community?
Sure, and sample site collection to some extent depends on your objective. So if you're looking at surveilling a whole community or part of a large city, sampling at the wastewater treatment plant can be very efficient. Oftentimes, wastewater treatment plants will already be collecting samples for regulatory purposes. So it can be pretty easy to work with the folks that are already sampling there, usually collecting a 24-hour composite. And that's how we work with a lot of our treatment plants we confirm that they're collecting a representative sample, but we work with them to collect those samples. When you're looking at a neighborhood or a facility, you're working with the municipality or the facility and looking at their septic system, their sewage system, drainage network, and selecting a place that's going to identify the area that you're interested in monitoring. At a retirement facility, there may be 1 or 2 cleanouts from the system that you can sample from, or from a particular neighborhood, you just find the right manhole that you can sample from and collect from that location.
Okay, very good. Thank you. Another question, and it's a question that I've had asked quite a bit, but I'd like to hear your response as well, is as far as refrigeration requirements. And, as I mentioned in my portion of the presentation, when you use portable without refrigeration, you have to worry about ice and gel packs and whatnot, and it could be a little bit cumbersome. But I've also heard that, initially we weren't real sure, and we were focusing on about 4 degrees Celsius, but then I've seen other reports and heard other people talk that provided the sample, and this is specific to COVID, remains below 70 degrees Celsius, that's fine. And I was curious what you found in your own experience.
Yeah, and we kind of follow the literature like you're mentioning, and for SARS-CoV-2, there's literature out there that shows that it is pretty stable for multiple days at a little bit higher temperatures. We've always used the refrigerated auto samplers, just partially to be safe for the SARS-CoV-2, but now as we've expanded out into other pathogens, they are much more sensitive to that temperature, and so keeping it refrigerated is even more important for us for that. So we use refrigeration on everything now. It definitely doesn't hurt anything, but like you say, for SARS-CoV-2, there's evidence out there that they are stable for multiple days at temperatures that are more than 4 degrees C, although you don't want to get too hot either.
Okay. Another question. If someone hasn't set up a lab yet for testing, what recommendations do you have for getting a testing protocol in place?
That's a good question, and I'll maybe back up on our lab a little bit. Like a lot of the people that were doing this, we set up relatively quickly, and we were at a university, and so we had a lot of RT-qPCR, some machines and some expertise there that we could transition into this space pretty easily. I know a lot of folks in the CDC, is some of their guidance is moving towards drop digital PCR. We just recently purchased one of them as well to expand on what we're doing. But there's some pretty standardized protocol. CDC is pulling together some really good guidance, in the Water Environment Federation as well. The other thing that I would say, like I've mentioned previously, is this space is super collaborative. And so if you know of somebody who you think is doing a good job, I would bet that if you reached out to them and just asked for some advice, that you could get it going pretty easily. and figure out what's best for you, and what your objectives are. How many samples do you have a day? And what are your resource limitations, so you can get the best and quickest results you can under whatever budget constraints you may have.
Okay. Another question. You just mentioned about funding, and you mentioned in your presentation the Rockefeller Foundation, and as far as funding, how do you see this being funded in the future? And do you expect funding to remain available?
Yeah, so we started off with a small internal grant to get things set up and start monitoring on campus, especially when the students were just coming back, and the university was pretty worried about what was going on, and everybody was really uncertain. And from there, our funding has always been kind of identified through our partnerships, starting off with the CARES Act and some ARPA funds, and working now with some municipality funds and health and human services funds. It's definitely, there's not one place to go to for this type of information and this type of to get funding to get this type of information, but there are different streams out there that can help get this set up for sure. And then, like any program, the long-term viability is an even broader question. Yeah, it just kind of depends on where you are and where the priorities are, and then educating those decision makers so that they understand that this is actually more economical than, that you can test 5,000 people with wastewater, but if you went out there and tested 5,000 people with individually, it would cost you a lot more and take longer to bring all that data together. And so it's that's a rambling answer for saying it kind of depends, I guess. But there is there.
I think what you said at the end was very telling, that the cost to do this wastewater sampling is so much less than the individual sampling would be, and that's certainly I would think would be quite a driver for continuing this type program. Another question, let's see. So you mentioned in your presentation that you use the airport as a sentinel site. So what public health actions will be implemented if you were to see a sharp increase in COVID or some other infectious disease?
Sure. Well, because we're in Oklahoma, a lot of times the new variant or the new disease, such as monkeypox, that may be coming into the area, it's not originating from Oklahoma generally. It's coming in from other places. We kind of know what we're looking for, and the wastewater sampling can give you, the 1 week early warning. But if we're looking at folks traveling in that may be bringing the disease in to the airport, it gives them, an extra week or two, kind of a heads up. Yep, it's probably going to be coming. Let's start gearing up, start getting the communications going, those types of things, so that people are ready when it gets here.
Okay. Very good. And I think one final question, and it is excited to see the modified Moore swab results, which is the passive sampling with the tampons, and curious how that compares with composite refrigerated samples. Do you have any early results for using this method? But we haven't seen any comparative studies yet.
Yeah, and this is some stuff that we haven't gotten published yet, but in general, for SARS-CoV-2, we actually were pleasantly surprised at the comparability of side-by-side sampling from flow-aided composites and the tampon samplers. And basically, we just take the samples 24, leave them in there for 24 hours in a little protected torpedo, and And then we squeeze it out in the lab, and then we analyze that water that we squeeze out. And if I had to generalize it, I would say it works better kind of in the middle concentrations. When you get really high, it doesn't necessarily work as well. And when you get on the lower end, when you're kind of closer to the detection levels, it doesn't work as well either. But for the middle range of the things that we were looking at, and I don't have stats on it yet. We haven't sat down and had time to do that, but we were seeing pretty good quantifiable results for SARS-CoV-2. We've started using them now on some other outbreak detections and things like that for some of our other pathogens. And once again, this is just observational. It seems like maybe for some of the larger microbes like bacteria that they might act, it seems they are actually probably concentrating them within the tampon. And so we're actually seeing higher concentrations of things like Campylobacter or STEC within the swab than we are seeing in the accompanying water sample. But once again, this is all just preliminary observational type of things that we're seeing. And we still need to dig in and make sure that those statements are statistically defensible.